To be here on your lunch break and listen. I'm Kate Schroder. I'm running for Congress against Steve Chabot in the 1st District, which is my visual aid, our gerrymandered district here. I'm born and raised in Cincinnati as well. I grew up in Pleasant Ridge. I went to Nativity for grade school and Ursuline for high school. So 12 years of Catholic schools instilled in me a very strong sense of service and social justice that was reinforced by my parents. And just to start with sharing a little story, when I was in 5th grade at Nativity School, we had to go to church. We went every Thursday at Nativity and then Sundays as well with our family. And it was always altar boys that would be in the white robes and up front helping the priest. And one time when we were in 5th grade, the priest came to our class and said, we need an altar boy for Sundays, or anybody here in our class who can do it. And it was silent. And everyone just sat there. And he asked again. And it was silent. And so I raised my hand. And the priest looked at the teacher. They kind of exchanged a glance. And then they said, well, do you know what to do? And I said, I've been watching it for 10 years. I think so. And they said, okay, well, come on Sunday. And I went on Sunday, and I did it. And it was fine. And it was no big deal. And from then on, there were always altar girls in Nativity after that. And I share that story because that's who I am. I am a doer. I'm somebody who raises my hand when I see there's a need. It's not about me. It's about helping. And I've spent my career helping others and getting things done. It's what motivates me. My whole family was in healthcare. I decided I was going to be different and go into politics and policy of healthcare. And I spent 3 years working in that after college. So I went to Indiana, then I worked for Senator Evan Bayh in DC, in his DC office. And I spent another year and a half working in City Hall here. And my takeaway from that was, holy moly, nothing gets done. And that was in '99. So I thought, let me go get my MBA and be able to flip between the public and private sector. So I'll stay involved in politics privately, but have a career in something else. And that's what I did. I got my MBA at the University of Pennsylvania, the Wharton School, and then went and worked in best practice research for hospitals for 3 years, based out of DC. And from there, I was actually recruited into global health. So I worked 12 years for the Clinton Health Access Initiative. First, I was hired to be the country director in Zambia. So I moved to Zambia when I was 29 years old, opened the office there, lived there for 2 years, which was just a transformative life experience to see our country from the eyes of another country, to live in a place where so many people die of preventable causes. You can't drink the water, you don't have reliable electricity. It is very eye-opening and makes you forever a grateful person with a ton of perspective. And I stayed in global health for another 10 years based out of the US, the last 7 years here in Cincinnati. I've led a number of projects. I stepped down in July as a vice president of the organization of 1,400 people. I was leading our pediatric treatment work globally across 5 countries, including a $70 million project. And one of the things I'm most proud of is that I was able to, diarrhea is the #2 killer of kids globally. I'm not supposed to talk about diarrhea, but just for a minute. #2 killer of kids, 530,000 kids die a year from it. All of them are preventable. Half through vaccines, the other half through treatment. And yet these kids aren't getting it. And so we led a project across 4 countries, Kenya, Uganda, Nigeria, and India, not the easiest of countries, to prove that we could get treatment rates up. We got the cost of treatment down nationally in those 4 countries, 40%. And we increased the number of kids getting correct treatment, 1.2 million to 55 million kids. I am incredibly proud of that work. I believe in science. We published 5 articles this past summer on that in peer-reviewed academic journals, and it's estimated to save the lives of 76,000 kids. So super proud of that. Here in Cincinnati, I serve on the Board of Health, and I work with Mr. Washington, also in our health department. And one of the projects I'm really proud of in the health department is expanding access to dental care in our public health clinics so that more adults and children don't have to choose between debilitating pain and going to school or work. So that's who I am. I like to get things done and help others. I am a problem solver at my core. When I was 33, I'm 42 now, I found a problem I could not solve. I noticed I got super sick with the flu, and I had lumps right here in my right clavicle. And I didn't think anything of it. The flu went away, but these bumps stayed. And a few weeks later, I came home. It was November 2010 for Thanksgiving, and I showed my dad after dinner. My dad is an oncologist, and I was showing him because he was a doctor. But I said, Dad, what do you think about these bumps? And he felt my clavicle, and he felt the back of my head. And he said, Kate, this is the classic presentation of lymphoma. And, you know, I was 33, I didn't believe him. And I was like, Dad, it's gonna be fine, it's what you see. But he was a very non-alarmist person, and he sat me down every day at break and said, this is what you need to do. When you get back to DC on Monday, you have to go have it checked out. And I did, and he was right. Scans and a biopsy confirmed it was Hodgkin's lymphoma, and I was gonna have to go through 4 months of chemo to have any chance of beating it. And I think a lot of people in this room have days like that, where everything changes in one moment. You are going along with life, and suddenly, you know, what you thought was stressing you out doesn't matter at all, and everything in your life boils down to 2 questions. Can I access the treatment, and will it work on my body? And it is a completely vulnerable feeling, and that is a huge part of why I'm running for Congress. It is not okay to play politics with people's lives. Access to healthcare is a human right. Chabot has voted over 50 times to take healthcare away without any alternative plan. He's voted against coverage for pre-existing conditions twice, despite promising that he would protect them. And our country has so many real and pressing issues that need attention, and we are not going to solve them with the status quo. Whether it's housing, affordable education, climate, the evaporating middle class, we need people who are low ego, who go in there and put ego on the back burner with a focus on results and values and getting things done. I'm a mom who knows how to de-escalate. I do it every day. My kids are 4 and 6. But it is, I really believe that this is our opportunity this cycle. This district has never been more competitive. It is down to 2 points this cycle. And it is considered the most flippable district in Ohio. So we absolutely can do this if we work together. It is not winnable individually. It is working as a team. I'm not taking corporate PAC donations. This is a people-powered campaign. I am very proud about the resources that we've raised. We've raised over $700,000 so far. We have to get to over $3 million to have any chance of beating him. We came in 3rd in the country in our first quarter for fundraising among first-time Democratic candidates. We have the endorsement of the Hamilton County Democratic Party. 18 local elected officials are building a broad coalition from school boards, state reps, city council members to make this happen. It is the only way we win it together. So I am excited to raise my hand and be part of this movement and do it, and grateful to have all of you here today to listen.